We know the pandemic has had a big impact on hospital appointments, and it seems a lot of patients needing to see a dentist are also being affected.
NHS figures show almost 19 million dental treatments have been missed in England since March. The British Dental Association says many practices are operating at a fraction of their capacity, and that could soon go out of business. They could. Dan Johnson has more.
The pain starts to become excruciating. Like I'd imagine acid being poured in the eye.
Listen to what toothache did to Tim, and imagine dealing with that much pain.
A filling that fell out and a tooth that had shattered into pieces. There was 2 or 3 teeth next to it that had all got together and formed one big infection that had gone right up that nerve into the sinuses and around to the top of the eye, and was basically like having somebody pushing in your eye really, really hard.
He was suffering with an abscess, starting to go blind, and despite many calls and even a visit to hospital, he couldn't see a dentist because he wasn't registered and treatment was restricted.
I got the sense that they were all closed, and that if you were suffering, the best thing you could do was go home and suffer. There were moments where I was contemplating home dentistry, and I was considering the whiskey and the drugs and the pliers option, but because it's right at the back, it would have been, and it was splintered into fragments, it would have been a very messy and brutal thing, and I wouldn't have been able to do it with any precision. But that was frequently on my mind. Yeah, I did have some incredibly dark thoughts, because it got to the stage where I just wanted it to stop.
After 8 months in pain, friends covered the cost of private treatment here. But other patients are still reluctantly being turned away or kept waiting.
Tim's story made me cry. I know it touched the hearts of my team. It's not what you're trained to do. It's, as a hygienist that manages a practice, my dentists feel the same, my staff feel the same. It's heartbreaking. We're going to see rising gum disease, rising mouth cancer, rising anxiety, rising mental health because people lose teeth. So it doesn't bode well for the future of dentistry.
The wait to get in here only looks likely to get longer because dentists are still restricted in the treatments they can offer and the number of patients they can see. So they're likely to suffer more, and dentists are wondering about their future prospects. And the question being asked is, what's the government's commitment here to the future of dentistry? The Department of Health and Social Care told us priority access should be given to urgent care and vulnerable patients, and it says the NHS is working with the profession to make more treatment available. But there are questions about the way dentists will be paid in future and what that will mean for waiting lists. Here, leaving an hour between patients and the cost of mountains of protective equipment is putting this practice and hundreds more at risk.
Before COVID-19, we used to see about 20 to 30 patients a day. We're now barely seeing 10. This is really quite difficult for us. We're all trying to do our best. From the beginning of the pandemic, our practices have stood up as urgent care sites, and we continue to work with our local commissioners. But at the centre of the NHS, we don't really seem to get the support that we need. And we're sites where the majority of our work is NHS dentistry, and we're just trying to help patients. We're open to almost 11 o'clock at night, and we want to carry on doing that. But we're going to need some help.
Tim's now on the mend, but other patients are still struggling to get seen. And if some dentists don't survive, that will only get worse.
I wouldn't recommend having this if you're poor or marginalised in any way. The difference between NHS and private could mean the difference between suffering and not suffering.
Dan Johnson, BBC News, Brighton.
Well, quite some stories there, weren't there? Joining us now from Birmingham is the chair of the British Dental Association, Eddie Crouch. A morning to you. I mean, the first things first, the last thing you want is people taking, the teeth into their own hands in some ways, isn't it?
Yeah, I mean, I was on your programme earlier when the first lockdown was occurring, and we were hearing stories like this, and 8 months on, it's terribly distressing to hear that people are still having these problems and suffering and not able to access care.
So 19 million dental treatments have been missed in England, according to this data. What kind of impact, long-term impact, will that have on patients, first of all?
Well, dentistry, when it's problems in the mouth, when they're picked up early, are relatively easy for us as the dental profession to treat. And the more advanced the problem is, by the time we actually get to see it and start the treatment, the poorer the outcome. And that's especially true in things that are really life-threatening, like oral cancer.
So are you concerned that people, with that, it might be being missed at the moment?
Absolutely. I mean, many lesions that occur in the mouth are asymptomatic to the patient. The patient wouldn't know about them. The screening that dentists carry out regularly at their 6-monthly, 12-monthly checkups would pick these up at an early stage. The treatment's so much easier for the patient. The life chances of the patient, if they're picked up this early, are so much better. Sadly, this may be being missed on a daily basis, and many of these patients will have a very poor prognosis.
Right. Let's talk about emergency appointments. Are people able to get those at least?
Well, the vast majority of practices are now open, but as my colleague said there in the interview, the numbers of patients we can see on a daily basis is very, very restricted, and as a consequence of that, some waiting lists are being added to on a daily basis and getting longer rather than shorter.
Of course, safety is absolutely key to all of this, but so how could things be speeded up, do you think, safely?
Well, we had a report from Public Health England that came out a few weeks ago that said if dentists could have some equipment in their surgery to change the airflow in the surgery on a more frequent basis, we would have a shorter period of time between patients and hence see more patients. But that investment into dental practices will cost significant amounts of money. We're asking today for the government to actually put that money into dental practices so patients can be seen, more patients can be seen, and fewer patients like the poor gentleman in the report will have the problems that he is having.
Presumably, I mean, you talk about the financials of putting in the extra air conditioning or whatever it might be needed. I mean, practically, that's presumably quite difficult because every surgery is different too.
Absolutely, and some of my colleagues will be working in surgeries where that's not possible, and the viability of their dental practice will be called into question. Many practices work on a model of mixed NHS and private care. We've had access problems in dentistry going back many, many years, and this has made the situation far, far worse. 12 months ago, I was on the BBC talking about the millions of patients who were struggling to get access. We now have a situation that's making this a crisis.
The Department of Health and Social Care, a spokesperson gave us a quote at least. The NHS is working hard to resume the routine elective services that were paused as part of the response to the unprecedented COVID-19 pandemic. All dentists are able to remain open to patients, and those holding NHS contracts have continued to be paid in full throughout the pandemic. What's your response to that?
Yes, I mean, all of that is true. We are working very, very hard with Department of Health and NHS England and all the other UK countries to get services back to normal. But we need support. I have a meeting on Wednesday with Joe Churchill, the Minister responsible for dentistry. I notice you've got Matt Hancock coming on soon. Perhaps you might mention it to him. We need additional support, and I hope Joe Churchill gives me a receptive meeting on Wednesday.
And for people thinking of taking, their own teeth out, what would you say?
Please don't. My colleagues are working very, very hard to get the most urgent cases into their surgeries. Please contact your local surgery, and my colleagues will do their absolute utmost to get you in. But there is sadly a backlog, but we will prioritise the most urgent cases. Okay.
Eddie Crouch, Chair of the British Dental Association, thank you very much for your time this morning. Thank you.